the measures that, and it's a basic measure to be taken to minimize the incidence of cervical cancer. So it's we will actually going to cover certain objectives during this lecture. We will discuss about the epidemiology and the risk factor, pap smear and HPV infections, define the transformation zone, explain the procedure of pap smear and how it is done, and the role of acetic acid and butyl iodine on examination of the cervix, and explain the colposcopy as a diagnostic tool, and certain points and how to treat cervical abnormality. Okay? Right. So cervical cancer, we know that it is not that common, right? It is the third most common gynecological cancers and fourth most common cancer in the woman. Right? The first is breast, then endometrium, then ovarian, then cervix. طيب. طبعا the most lethal or the most aggressive tumor is ovarian. The background behind it, because it is usually diagnosed late. In cervical cancer, we have a benefit of screening techniques and screening programs. It's dramatically affected the incidence of cervical tumors. Okay? So, what is the, what do you think? What are the overall incidence of cervical tumor or cervical cancer?
80%, 20%.
It's about 1 to 2% worldwide. And now it's more dramatically decreased because of the screening programs, okay? And because of the vaccine. Most of the incidence occurs in low socioeconomic status and in areas where the screening program is less. So the incidence is higher there, okay? عادة cervical tumors, they have two risk factors. The first risk factor is HPV related, and the second risk factor is non-HPV related, okay? So the HPV related, what do you think? What could be the cause of cervical cancer because of the HPV?
Sexual potential.
Okay, so unprotected, multiple partners, right? What else? What else? STDs. What else? Early menitis, اللي هي البنات اللي يتزوجوا بدري. إيش كمان؟ Partner that have multiple partners, okay? Or a partner who has cervical tumor, okay? Or cervical abnormality. خلاص? What else?
Unvaccinated.
Unvaccinated, the incidence is more. صح. What else? هل يعتمد كمان على البirth؟ على pregnancies and birth? Yes.
Multi-parity.
No.
Multi-parity per se, no. But if she has first child in younger age, she will have more incidence. Okay? Not multi-parity. Also, vulvar tumor is highly associated with cervical tumor. The same cause of vulvar tumor, you will find it in cervical tumor. Okay? So if can indic any vulvar tumors, you will have higher incidence of cervical tumor. Right? So these are the HPV related causes for cervical cancer. Like non-HPV related, like smoking, low socioeconomic status, contraceptive use.
Why? Why the OCP?
OCP عادة because of turnover حقت cervical cells يكون عالي. Okay? What else?
Yeah.
Genetic. So genetic predisposition. Family history per se ما يسبب cervical cancer. Why there is genetic predisposition? لأنه family they are living in the same socio-economic status, so they have predisposition. بس ما في genetic predisposition. Okay? طيب. So as we said, the most important and the most يعني زي ما تقولي criminal thing is HPV. Okay? In 90% of the patient who has cervical cancer, you will find HPV. Okay? Some other 1 or 2% is non-HPV related cervical tumor. طيب? Okay, so what is HPV? It is a DNA double-stranded viral genome, right? Like, so where does it affect? On skin and mucus, right? In mucosa. So most highly affected, or the higher rate of infection occurs in the vagina and in the oral cavity and in the anogenital area. طيب? The thing which you have to remember is the HPV is يعني عشان يسوي من infection إلى cancer, it will take very long time to change. It takes about 15 years to change from the infection to the cervical cancer. Okay? But other associated lesions that you can find other than the cancer with HPV are ايش ممكن تلاقوا غير الكانسر؟ واحدة عندها HPV ايش ممكن؟ warts. So ممكن يكون عندها warts، ممكن يكون عندها ulcers، ممكن يكون عندها erosions. Okay? Before it turns to cervical tumor. Okay? طيب. So how many strands we have for HPV? تقريبا more than 100 strands. Not all of them are carcinogenic. Some of them, they are highly oncogenic in nature. Most commonest is 16 and 18. Okay? There are some low risk oncogenic types, which is 6, 11, and so on. Right? So you remember what? 6 and 18. Sorry, 16 and 18. Right? 16 يسوي نوع معين من cervical tumor, and 18 يسوي نوع ثاني. Okay? So most commonest HPV genome is 16. طيب? 16 is the highest rate of carcinogenic nature. Okay? So in comparison, 16 and 18 combined, they are responsible of 70% of cancers. Okay? طيب. طيب. This one we discussed. Now this is the process how the HPV turns to cancer. Okay? So first she may get an infection, initial infection, and it may be dormant for a long time till the manifestations starts. Okay? It could happen mild dysplasia, moderate dysplasia, and then she may have يا إما progression يا إما regression, and she may have some atypical cells and leading to cancer, which is كمان invading the basement membrane. خلاص? So this is the process of cancer. طيب, the most common histological type is squamous cell carcinoma. خلاص? And HPV 16 are responsible for that. You will find higher rate of HPV 16 in squamous cell carcinoma, while HPV 19 you will find more with adenocarcinoma.
19 or 18?
Who was 16 and 18? الريت حقت ال 16 أكثر في squamous cell carcinoma وال 18 في الادينوكارسينوما. طيب there are certain other types اللي هي adenosquamous carcinoma. They are rare but they are very highly potent. The prognosis is poorer than squamous and poorer than adenocarcinoma. The others are adenoid cyst carcinoma and neuroendocrine. They are also very rare, and كل ما كان التيومر rare كل ما كان aggressiveness is more. طيب خلاص. So 16 more with squamous cell carcinoma and 18 with adenocarcinoma. Okay. طيب you have to remember that cervical cancer usually starts from transformation zone. What is transformation zone? المنطقة اللي بين الإكتوديرم والإندوديرم اللي هي ectocervix والendocervix. طيب هل في different cell type? Yes, there is different cell type between the endocervix and ectocervix. اللي هي junction between the squamous epithelium of the ectocervix and glandular epithelium of endocervix. Okay? So endocervix is glandular. Ectocervix is squamous cell. Okay? So you can find a tumor which is high incidence in transformation zone. There is another area where you can find tumor which is the endocervical canal. When you examine this patient, you will find that the cervix is barrel shaped. يعني تحس إن cervix is very hard, like cylindrical hard. Okay? So this is known as barrel shaped tumor. خلاص؟ طيب. So what do you think? We will not go with the staging, stage 1 and 2, because it's not there in your objectives. We will just generally will know how to diagnose the cervical cancer and how to stage it. What do you think? What is the staging technique for cervical cancer? So it is a clinical staging. Okay? It is ايش؟ clinical staging. يعني by examination. في ovarian cancer, the staging is not clinical. It is surgical staging. عرفتوا؟ يعني ايش الفرق؟ مثلا جاتكم حالة في الإكزام قالوا لكم إنه مثلا 50 years old lady she is having pelvic-abdominal mass or ovarian mass which is complex 7 centimeter, and there is lymph node enlargement and chest X-ray showed a small nodule in the lungs. So what is the stage?
Have to open up.
Yes. So you have to do surgical staging before deciding what is the stage. خلاص. By description you cannot. By examination of the mass you cannot stage the patient.
Exploratory.
So you have to do for her staging surgery or debulking according to the level of the tumor. Okay? And you have to take a biopsy from the lung to confirm if it is a metastasis or it's another it's a nodule for other reason. Okay? So this is surgical staging of ovarian cancer. Regarding cervical cancer, by examination. ليش؟ لأنه nature حقت cervical cancer it spreads locally. عرفتوا؟ يعني أغلب الأوقات it spreads locally. يروح local area. Okay? So you have to do clinical staging. The first step in clinical staging is physical examination. You have to do complete and full pelvic examination by speculum, by bimanual examination, rectovaginal examination, and palpation and inspection of the tumor and uterus, vagina, and parametrium. Okay? So this is how would you stage the cervical cancer. or you examine for a distal metastasis. وين يكون الميتاستاسيس for cervical cancer؟ أول منطقة يروح فيها الميتاستاسيس. طيب هو يروح فوق endometrium، okay، ويروح vagina. طيب the other second area اللي هي لا يروح للinguinal lymph node. طيب so you have to examine the inguinal lymph nodes, and then the last stage is bone. Okay, so palpation of the groin and supraclavicular lymph node and examination of right upper quadrant. Okay, there are supraclavicular lymph node is known as sentinel lymph node. طيب so you have to examine her. This is the first step in staging. The second step is taking biopsy. طيب بالنسبة للbiopsy, if you examine the cervix and you didn't find any obvious lesion, what you have to do? You have to do pap smear, صح? And you have to take biopsies. اللي هي bicolposcopy بعدين نجي لها ونحط dye معين وناخذ biopsies. خلاص؟
حتى لو كان examination
ايوه multiple biopsy اذا كان invisible. اذا كانت visible على طول ما يحتاج pap smear، على طول تاخذون البيوبسي من invisible يعني lesion.
حتى لو كان negative physical examination ولا مع
لا هو ما negative physical examination عندها symptoms of suggestive of cervical cancer. Yes, you have to take pap smear, and according to the results of pap smear you take the biopsy.
دكتور طيب بالنسبة قبل شيء mentioned invisible، طب أنا ليش أصلا قاعد أسوي الباب سمير؟
طيب في recommendation للباب سمير، يعني واحدة في recommendation حنجيها الآن متى تسوي باب سمير. طيب إذا إذا كان invisible you do pap smear according to your guidelines. طيب إذا كانت visible lesion you take biopsy. فهمت كيف؟ إذا في الباب سمير شفت إنه في إيش اسمه atypical cells, then you go for colposcopy and then take biopsy. So it depends on the results of pap smear. This is in patient who has invisible lesion. Okay? If there is a visible lesion, then you have to take a biopsy and confirm that she is having a cancer or other lesions, like condyloma acuminata or something like that. Okay?
So instead
هذه كلها staging حق confirmed cervical cancer.
يعني هي عندها already confirmed
عندها
diagnosis.
أيوة confirmed diagnosis and how to stage it. Okay? So then you can do endocervical curettage, hysteroscopy, cystoscopy, proctoscopy. هذه كلها techniques of staging cervical tumor. Okay? Also you have to do, it's a big bunch of investigations that you have to do to complete your staging process, chest x-ray, PET scan to see if there is any bone metastasis, IVP to see if there is any obstruction. لأنه cervical tumor they go locally, so it can be metastasis to the bladder or to the rectum. Okay? MRI طبعا MRI, the benefit of MRI is to see the soft tissue. Okay? So it's very good technique to evaluate the extent of the tumor. Okay? So this is how to stage. According to the stage, you have to treat the patient, right? Right. So how would you treat the patient? According to the tumor size and according to the local spread and according to the metastasis, right? Usually the cervical tumor in the first stage, it is curable. Okay? Yani this is a very unique thing in cervical cancer. And no, you can cure the patient if you diagnosed it or you detect her in the first stage. Okay? But how can we protect the patient? As we said, by two things. Vaccination is one of them.
Screening.
And screening. Okay? So this is how we protect the patient. But screening, we have only pap smear. So, like, pap smear is a technique or a method to evaluate or test the cells, which is in the cervix. Usually we take it from the transformation zone, okay? So in any pap smear results, you have to have transformation zone cells to make it complete pap smear, okay? طيب احنا عندنا كم نوع من الباب smear? We have two kinds of pap smear. The one which is there, it is known as thin prep. This one is conventional, اللي هي كانت من قديم الزمان موجودة. Okay? Both of them, they are highly sensitive, they are highly effective, except إنه conventional اللي هي فيها slide كان فيها مشاكل في الفيكسيشن وإنه لأنها تنحط في slide. اي ولازم يكون فيها fixation. Immediately you have to put the fixator and immediately you have to send it for the lab. Okay, and it has a lot of debris. يعني لما تحطوها في slide البيكتشر ما تكون واضحة زي التhin strip. Okay. So you know now from where we took the pap smear? From the transformation zone. Okay. And from the cervical external اللي هي ectocervix and endocervix. طيب. طيب. So as we said اللي هي transformation zone, how does it occur? How does it?
تو انت قلت يعني سابق انه لازم نغطي كل الاريا.
Mm.
Do I use different pap smear يعني different sample for each one؟ يعني مثلا غطيت transformation zone and I take another one. I take another
إن شاء الله الآن بقول لكم كيف تفحصوا بالضبط الباب smear. We'll come to that, and you will know how we are doing and how we are taking the ecto and endo. Okay. طيب. So we have transformation zone. Transformation zone, it has two layers embryologically, which is a Mullerian duct, which is linked by columnar epithelium. Okay. And from urogenital plate, so the embryonic sites are different. Okay. The Mullerian duct by columnar and urogenital plate by squamous epithelium. خلاص? So the blood supply, is it different? Yes, the blood supply is different. The cell type is different. So you have to know this to know what is the pathophysiology behind the cervical tumors. Okay. طيب هذه يمكن الصورة بالمحاضرات عندكم حتكون أوضح. هنا هذا transformation zone. هنا حتلاقوا لأنها glandular فتلاقوها شوية أحمر. هنا حتلاقوها شوية على light pink كذا. Okay. So هذه اسمها transformation zone. هذه ectocervix وهذه endocervix اللي هي endocervical canal. خلاص؟ So a tumor يا إما it originates from here and spreads to the ectocervix, or يكون عندك endocervical canal tumor. طيب. So when you feel it, the endocervical canal, you feel it as cylindrical, hard structure. Okay?
الريتمز دي طبيعية نورمال.
إيه هذه normal. Okay? طيب. So now we will come how to do the pap smear. طيب. First of all, to do pap smear, you have to have your instruments complete before positioning the patient and starting the examination. طيب. So how would you examine? How يعني أنتوا عندكم OSCE exam صح؟ طيب. Let's say that you have a station which is pelvic exam, okay? And you have to do pap smear. So how would you start?
طبعا typical introduction.
So you'll introduce yourself and take permission, and then
Ensure
Explain.
privacy.
ensure privacy, use chaperone,
Chaperone, then exposure.
then
explain
the procedure,
consent
consent, verbal consent.
انت بلادر
لا أول يعني أول شيء yourself, right? So you should wash your
Wash your
hand and
hands.
warm it and put on your gloves, and then check your instruments if they are complete or not. So what do you think? What are the instruments you should use during pap smear? أول شيء speculum, good.
Lights.
مع السبيكولم عشان تكونوا مرتبين. مع السبيكولم lubricant.
Lubricant.
صح؟ طيب بالنسبة لللوبريكانت في الباب smear and for swab, it will interfere with the results لأنه فيها مادة الكروم. Okay, so it will interfere. Try not to use it. Usually we are using اللي هو tap water. Okay, water يعني. طيب بس في الاختبار بيحطون لكم اللوبريكانت يعني. Okay, then
gloves.
Okay.
باب سمين
Pap smear. So pap smear we have two kinds as we said. إذا تستعملوا الثين بريب إيش تحتاجوا؟ تحتاجوا إلى liquid base اللي هو الثين بريب حيكون كذا علبة فيها موية. زيتون هنا. أوكي؟ So حتكون هذه السولوشن اللي هي ثين بريب وحتكون هذه سايتو برش. اسمها إيش؟ Cycle brush. Or you will have this one which is spatula and a brush. خلاص؟
والفيكسيتر حقه طيب.
لا هذا ما يحتاج فيكسيتر، هذه thin prep. هذا ما فيها لا سلايد ولا شيء، حتلاقي كذا solution مكتوب عليها thin prep وهذه اسمها cyto brush وهذه اسمها spatula وهذه اسمها brush. اوكي؟ هذه مع بعض. يعني إذا هذه موجودة هذا ما يحتاج. طيب إذا هذه وحدة موجودة هذا ما يحتاج. خلاص؟ clear?
Yes.
طيب. So you will find this. You have to name them. So you have thin prep, you have cyto brush, or you have thin prep with spatula and brush. فهمتوا؟ أي؟
Yeah.
طيب. So with the instruments you will have thin prep اللي هي liquid based solution, thin prep, and you will have either this one cyto brush or you will have this يا إما this or this. ما حيحطوا لكم كلها كاملة. Okay? So thin cyto brush or spatula with brush. طيب ليش احنا نستعمل الحين اقول لكم ايش تسووا. اول حاجه ايش تسووا بعد ما تحطوا السبيكولم position the patient in dorsiflexible position, exposure طبعا من الsuprapubic to the lower هذا, and then you have to put the speculum in a proper way. قالوا لكم كيف تسووا pelvic exam,
Yes.
how to
That's very good.
so you put your instrument in a proper way, and then if she needs vaginal swab, you have to take vaginal swab, and then you do the pap smear. How would you do the pap smear? The first step, إذا عندكم هذول الاثنين هتستعملوا أول شيء البرش. You put it in the endocervical canal and rotate. Okay? In the endocervical canal and rotate. يعني هنا. هنا هذا endocervical canal and rotate. خلاص؟ طيب؟ And then you put it كم مرة you rotate? 5 times. Clockwise 5 times. Do not do like this, then you will destroy the cells. So you take it in one direction. Okay? So use it clockwise 5 times, and then you put in the solution and stir it, and then خلاص. هذه the endocervix. Then you have to use this one, which is a spatula. خلاص? You put this part, اللي هي longer part, you put it in the endocervix, and this one حتكون على الectocervix. فأنت أخذت ال endocervical canal وأخذت من هنا transformation zone والectocervix. واضح؟ واضح؟ You rotate it the same way 5 times, 360 degree يعني دورة كاملة, clockwise 5 times, and then you stir it in the solution and close the solution.
كيف تثبت طيب دكتور؟
ما هذا ما يحتاج تثبيت، هذا مو سلايد.
أنا فاهم بس إنه أثناء البروسيجر إنه أنا قاعد أسويها كيف تثبتها؟
ثبت إيش؟
السباتشولا إنه عشان تكون حركة كاملة.
حركة كاملة. شفت هذه الصورة؟ شفت هذه الصورة؟ هي السيرفكس ثابت ما هي متحركة.
حلو أنا أقصد السباتشولا نفسها.
السباتشولا تحطها في نفس الاندوسيرفكس وتدورها.
تثبت هي معي.
تثبت ايوه.
أوكي.
خلاص؟ طيب. So this is how would you do the thin prick. Okay? The other اللي هو السايتو brush the same way. هذه تحطها في endocervix and then rotate it. This is very easy, easier and more convenient يعني. تحطها في endocervix and rotate it clockwise 5 times, 360 degrees. And then you put it in the solution, stir it for 10 times. والبارت الأبيض تشيله وتحطه في السولوشن. وترسل اللي
لا.
لا. clear؟
بعدين اروح استخدم هاي البرش امسح نفس الطريقه اللي
لا 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 لا، يا هذه بتستعمل أو هذه. إذا أخذت سانتو برش ما يحتاج تستعملها برضه. أوكي؟ clear؟ واضح؟ طيب. This is the first technique. The histopathology. Yes. So the histopathology is as clear as this. في thin prick. هتلاقي السيلز مرة clear, مرة واضحة. والbackground is white. So you can examine very clearly. هذه normal. وهذه فيها cancer cells because you find a lot of atypical cells. There is mitotic figure. The nuclei is very large in comparison to the cytoplasm. So this one is abnormal pap smear. Okay? So it's very clear. The second method is this one, which is conventional. في الconventional حيعطوكم كذا يعطونكم kit. الكيت هذا فيها 3 أشياء. أول شيء سلايد وحتلاقوا هذه spatula and brush. طيب spatula brush وهنا slide. فإيش حتسووا؟ أول شيء حتاخذوا البرش the same way تاخذوا البرش تحطوه في الاندوسيرفيكال وتمسحوها كذا بالسلايد هنا. تمسحوها كذا بالسلايد. أوكي؟ في ربع سلايد. بعدين حتاخذوا spatula the same way. This longer part حتحطوها في endocervix and this one you rotate it. Okay? And then you fix it or you spread it here. And then على طول you have to put a fixator and send it to the lab. Okay?
دكتورة تو مو تقولين لا عادي يسوي واحدة منهم؟
إيه هي واحدة يعني يا إما conventional. It depends on your hospital facility. الآن most of the hospital they have thin prick. لأنه more convenient. هنا debris is a lot. There will be fixator problems. في thin prick لا ما يحصل هذه الأشياء. Okay? So this is the fixator. And the second هنا طريقة spreading بعدين تحط الفixator. Clear؟ في سؤال؟ في سؤال؟ طيب. So طبعا this is the recommendation of pap smear screening for women. Okay? طبعا حتلاقوا كثير من screening programs. Okay? The most commonest and the most famous is FIGO classification. غالبا الكانسر classification FIGO classification. Okay? طبعا Canadian classification وفي Australian classification وأشياء زي كذا, but the FIGO classification is worldwide used. Okay? So for FIGO classification, they said women before 21 years of age, we don't do pap smear. Why? Because studies showed that before 21 years, the incidence of cervical cancer is only 0.1. So it's not يعني cost effective إنه قبل ال 21 سنة نسوي لهم الباب smear. Okay? Even if she got married. طيب before the 21, we use only we start screening after 21 years of age. خلاص? And once she is 21 years of age till 29 years نسويها every 3 years. هذه في low risk patient. تذكروا احنا قلنا في high risk patient like smokers, immune deficient patient, patient who has family history, strong family history. patient who has multiple partners. هذا كله high risk patient. This one is for low risk patient. Okay. طيب. So from 21 إلى 29 years every 3 years. Okay. From 30 to 65 cytology alone every 3 years. طيب إذا سويت مع السيتولوجي HPV test حيكون كل 5 سنين. أوكي؟ لأنه مو كل اللابس عندهم HPV DNA test. أوكي؟ مع الباب سمير. So if your hospital has DNA test, then you do it every 5 years. If you don't have this facility, you do it every 3 years. Okay?
سيتولوجي نكتب باب سمير.
طيب أيوه pap smear. طيب age greater than 65 years, no need for screening, provided إنه عندها negative pap smear before. Okay? واضح؟
واو.
ليش؟
وعنده ممكن يصير كانسر.
ها؟
اللي عنده كانسر من قبل ما
لا
لا إذا ما عندها كانسر، عندها pap smear normal ووصلت إلى 65 سنة، حتسوي لها pap smear؟ No.
لا لانه it takes 15 years وخلاص ما عاد بيجي بالعمر قد اللي راح له.
لا مو لهالدرجة يعني، مو راحت عليها لسه.
بس
هي لأنه الانسيدنس is very low. It's only 0.9%. It's very low, so it's not cost effective. Okay, but she should have this screening program. يعني إنه خلاص وصلت 65 وما قد سوت باب سمير، لا تعمل لها. فهمتي كيف؟ فهمت ولا ما فهمت؟
ما صارت من قبل أسويها.
أيوة سويها لأنه she was not screened before. Okay. طيب. If the patient is hysterectomy, يعني صار لها hysterectomy, how you need to screen it? No need for screening except in high-risk patients. Okay? طيب. So these are the recommendations.
hysterectomy يشيلون السيرفكس معه.
إذا كان subtotal ما يشيلون السيرفكس. إذا كان total يشيلون. طيب. طيب let's say that she is she is high risk patient. She's high risk patient. So you have to do it every 6 months for 1 year. خلاص؟ Every 6 months for 1 يعني مرتين تسويها في السنة.
كثير.
ها؟
كثير.
لا it's not. Every 6 months for 1 year يعني مرتين حتسويها pap smear لأنه she's high risk. High risk patient they have abnormality in the cervical screen يعني very fast. طيب؟
يعني الدكتورة إذا تشخصت بس أسوي لها في السنة الأولى بعدين
تشخصت بإيش؟
HIV بعدين
HIV حتسوي لها في السنة الأولى مرتين.
بعدين كل سنة.
بعدين كل 3 سنين يعتمد على الريزلتس. اوكي؟ طيب. If there كمان one of the immune suppressive إذا كانت هي got exposed to DES in utero. إذا أمها كانت تاخذ DES while she was pregnant, she is also one of the high risk patients. Okay? هذا كان كيموثيرابي يستعملونه في قديم الزمان للبريست كانسر. دايإيثايل ستيلبستيرول. اوكي؟ كانوا يعطونا المرأة فإذا هي كانت حامل في بنت while she was taking البنت يكون عندها high risk for malignancies. Okay? One of them is cervical cancers.
هل الريزولت will affect the screening?
طبعا. Now first, this is the first screening. This is for a normal patient who's asymptomatic and low risk. طيب? Let's say that you took a pap smear and there is abnormality in the pap smear. We'll come to that. What kind of abnormality and what you will do in each abnormality. خلاص? I'll make it simple for you. طيب. So, when you do pap smear for screening, طيب ويجيك result صح من اللاب. إيش الأشياء اللي تشوفها المفروض تشوفها في الريزلت؟ أولاً it should be adequate صح؟ كيف نعرف إن الباب smear is adequate؟ ممتاز. لازم تكون موجود فيها both columnar و squamous ويكون مأخوذ من transformation zone. Okay? هذه adequate pap smear. So first of all they will comment on adequate pap smear. الشيء الثاني they will comment on type of the pap smear. اللي هي conventional ولا thin or liquid based. Okay? Then they will write the results. Okay? And they will write the HPV test إذا كان مطلوبة. Okay? So these are the parameter of the results that will come to you. طيب. So specimen adequacy they will write satisfactory for evaluation. خلاص? Or unsatisfactory for evaluation. طيب, then they will write the results. طيب. الباب smear is a screening method, صح ولا لا؟ Is it diagnostic? No, it's screening. طيب. So if you have any abnormality in the cervical pap smear, you have to do biopsy. بس مش كل الحالات تسوي لهم biopsy. في حالة واحدة اسمها ascus اللي هي atypical squamous cell of undetermined significance. هذا الريزلت تصير if you have any kind of inflammation. Okay? تعرف cervix is renewable, صح? The cells is shedding and renewing. Sometimes you take pap smear in this time, يعني while the cells are renewing, or inflammation or infection. So it comes with this one, ascus, okay, which is corresponds to low grade. فاهمين؟
اوكي.
واضح؟
يعني هذه ما نسوي لها بايوبسي.
هذه ما تسوي لها بايوبسي.
يعني كلها
خلاص؟
بايوبسي لها.
كلها بايوبسي ما عندنا هذه. طيب؟ أبسطها لكم. كل ال abnormality حتسوون لها colposcopy وبايوبسي. You'll never be wrong if you write colposcopy and biopsy حتى مع ascus. طيب بس ascus you have another option إنه you wait for 6 months and repeat الباب smear. So you'll be right in both ways. سواء قلت colposcopy or إنه to wait for 6 months and repeat it. ليه؟ لأنه الاسكس الباك جراوند حقها إنه يكون inflammation, infection, اللي هو renewal of the cells. عرفتوا؟ ممكن يطلع باسكس.
الدكتورة البي سي ار قبل شوي منشنتيها ممكن نستخدمها as a diagnostic؟
diagnostic لا screening اللي هي ال HPV. أيوة screening still. Diagnostic you have to have histopathology مش cytology. يعني you have to have biopsy. Okay? طيب بالنسبة للباب سمير حيجيكم results اللي هي type of the cells which is there and the abnormality. Any pap smear who had glandular cell inside معناته هي جاي من endometrium. Okay? Glandular background of pap smear معناته جاي من endometrium. So you have to take endometrial biopsy إذا جاتكم في results glandular abnormality. Okay? واضح؟ واضح ولا عيد؟
يعني عندنا اسكس هذه wait for 6 months والجلاندولار ناخذ من فوق.
من الاندوميتريوم. ايش هو الاسكس؟
لا مو الاسكس.
نعم.
لقيتها بوزيتيف يا سكويمس اخذ بايوبسي سكويمس.
هو لا سكويمس مفروض يكون بس جلاندولر. اذا قال جلاندولر طيب معناته هي جايه من الاندوميتريوم. اوكي؟ جاي من الاندوميتريوم. So you have to take here atypical glandular cell. Okay? If you find this result, you have to take from the endometrium. Okay?
معناها endometrial
في something abnormal. Yes. معناته endometrial cell is abnormal and it's shedded with الباب smear. فحتاخذوا من الاندوميتريال biopsy. Clear?
Yes.
هذا very simple way. طيب؟ واضح؟ في سؤال؟ طيب. So زي ما قلت لكم interpretation. طيب. Let's say that there is طبعا احنا قلنا انه هذه screening test صح؟ We have to do biopsy. Any abnormality قلنا نسوي colposcopy and biopsy. طيب ايش الcolposcopy؟ سكوبي دائما ايش هو؟ منظار. So colpo معناته cervix. دائما colpo means cervix. So منظار للcervix by what? A magnifying lens اللي هو المجهر. هتلاقوه في العيادات مجهر كده كبير magnifying lens, and you have to examine by المجهر. هذا اسمها colposcopy. خلاص؟ It magnifies the cervix, يكبر cervix about 5 to 7 times. What is the aim behind this magnification? أول شيء هتشوفوا إذا في abnormal vasculature. Okay? يكون إذا كان في something abnormal في الcervix يكون ال blood vessel is very highly tortuous and increased in blood supply. طيب؟ هذه أول شيء. ممكن تشوفوا irregularity in the surface لأنه شفتوا أول شفتوا الصورة very smooth, right? إذا كانت something abnormal or cancer or something behind it, the surface is irregular, indentated اسمها. Okay? ممكن تلاقوا ulcers, small ulcers. Okay? ممكن تلاقوا mosaicism, يعني حتلاقوا إنه some يعني مش even, لا في irregularity.
زي موزايك.
Yes.
السيلز تشوفها
مش cells, appearance هذه.
يعني ما تاخذ بايوبسي تشوفها لا.
بعدين البيوبسي أول حاجة بتشوف السيرفكس with magnifying lens and you comment. طيب أول شيء لازم تكون السيرفكس كلها شايفها so it is satisfactory لأنه the whole part of the cervix you saw it. And then you mention what is the abnormality you are seeing. Is it increased vascularity? Is it mosaicism? Is it indentation? Is it ulcers? Is it lesions, small lesion? أحيانا بالعين المجردة ما تقدر تشوف small lesions كذا. فبالmagnifying lens you will see it more clearly. طيب؟ طيب. Then you have to apply certain solutions to evaluate more. We'll come to that. تاخذون biopsy. الbiopsy results, it will come like CIN1, CIN2, CIN3. طيب؟ CIN اللي هو cervical intraepithelial neoplasm اللي هي mild dysplasia اللي هي 1. 2 and 3 moderate and severe dysplasia. Moderate and severe. طيب ليش احنا نسويها كذا classification ومتابعين عمرنا CIN 1 و 2 و 3 ليش؟
عشان يتابع إذا في prognosis.
عشان التريتمنت عشان المتابعة. طيب هذه كلها pre-cancerous صح؟ عادة من pre-cancerous إلى cancerous دائما cervical tumor they will take long time to transfer. Okay? CIN1 corresponds to ascus اللي هي يصير mild dysplasia يكون في mild abnormality للcells. خلاص؟ So CIN1 corresponds to ascus اللي هي unsignificant determined cells. Okay? So هنا إيش تسوي؟ You just follow the patient. ليه؟ لأنه regression rate حقها without any treatment اللي هي more than 60%. And malignant transformation is more يعني less than 0.5%. This figures you don't need to remember بس يعني عشان أقرب لكم المسألة وتعرفوا ليش إحنا CIN1 ممكن ننتظر. Okay? لأنه it will regress by itself. 60% of them they will regress. 30% تقريبا they will stay as it is. Okay? And only less than 1% or 0.5% تقريبا they will transfer to cancer. طيب؟ So هذه CIN1. طيب؟ CIN2 and 3 CIN2 they will طبعا هو extent of abnormality. CIN1 only the superficial layer. CIN2 it will go to the deeper layer. CIN3 it will take the whole thickness except in the basement membrane is intact. أول ما يدخل البيزمنت ممبرين يصير كارسينوما إن سايتو. هذه أول مرحلة من مراحل الكانسر اللي هي كانت كارسينوما إن سايتو اللي السيلز يدخل داخل البيزمنت ممبرين بس ما يدخل ديب في ميجرمنت لها. أوكي؟ اللي هي less than 5 مليمتر. خلاص؟ هذه دخلت في كارسينوما إن سايتو. And هنا you have to be aggressive in treatment. طيب؟ Then you have cancer. Okay? So this is the importance of cervical pap smear اللي هي early detection and early treatment. زي ما قلت لكم إذا if you detect it in early stages you can cure the patient. Okay?
دكتورة CIN2 و 3 نسوي لهم treatment صح؟
لا CN 2 you wait for 6 months and then you repeat it.
وثري
3 لا 3 you have to be very careful every 3 months you أول ما يوصل carcinoma in situ you treat.
دكتور عندي سؤال بالنسبه للباب سمير يبين اذا كان بس في اتش بي في.
شوف ال HPV مو موجودة في كل السنتر عرفتني؟ مو كل السنتر موجودة فيها HPV في centers yes you can do HPV. طيب
بس يبين لك يعني السيلز.
يبين لي إن she is infected with HPV or not and what kind of HPV لأنه هو بيشوف ال DNA فبيشوف لك ال HPV هل هي high carcinogenic ولا هي low low risk HPV.
هذا تي سي ار دكتور.
إيه
طيب والسمير العادي هذا ابو 3 سنوات.
أبو 3 سنوات ما يبين لك ال HPV إلا إذا طلبته موجود في اللاب حقك بيسوي لك إياه.
اوكي.
اوكي مو كل الباب سمير تقدر تسوي HPV. هنا في السعودية يعني very few centers they do HPV test. عرفت؟ طيب هنا قلت لكم إنه glandular cell and هذا we discussed it already. And this is how to interpret. Okay? It's just repetition يعني. Okay? طيب. So هنا the types of abnormality of the pap smear زي ما قلت كلهم شوفي colposcopy and هنا الاسكس يا اما colposcopy يا اما routine screening اللي هي تعيدها بعد 6 شهور. اوكي اما اذا قلت كلهم colposcopy يعني حتى الاسكس if you start colposcopy you'll never be wrong. Okay so we said about it, colposcopy is magnifying visualization of the cervix. It will observe the feature of cervical epithelium by application of normal saline. Yes, we have to use 2 kinds of solutions. The first solution is normal saline, just you clean the cervix. طيب عادة ما يبين حاجة يعني ما يكون significant يعني you're just seeing sometimes you feel there is some darker area but it's not significant. The more significant one is acetic acid. تعرفوا الخل؟ هو acetic acid طبعا. You have to dilute it and you have to use 5% of acetic acid. لأنه إذا if you use الخل اللي موجود في البيت ممكن it will burn the area. So you have to dilute it. Okay? It will dehydrate. You put it right after you do colposcopy. Okay, you put the acetic acid and wait. خلاص. Once it get dried, okay, it will إيش اسمه يصير في change in the color, okay, of the cells. طيب. إيش يصير؟ Areas of increased nuclear activity and DNA content exhibit the most dramatic color change. Okay? يعني الابنورمال cell بيصير فيه discoloration. إيش الكلر اللي بيطلع؟ white. خلاص؟ So abnormal cell بيصير white. طيب؟ في other solution which is lugal iodine يصير العكس. النورمال cell it will become مش white هي lugal iodine بني كده. تعرفوا الميكروكرون اللي زي
معروف الحق السكوب هذا.
ايوه حق التعقيم. So حيكون بني. النورمال cell it will become color. Okay? So acetic acid once it's white معناته there is abnormal cell. You take the biopsy from that area. خلاص؟ Usually we take 3 biopsies. Okay? So this is يمكن الصورة هنا عندي أوضح. سكرين ما هي واضحة مرة لو تشوفوها بالمحاضرة نفسها حتكون واضحة. حتلاقوا هنا white area شوفوها هنا وهنا. هذه الاريا white لو تشوفوها في المحاضرة واضحة جدا يعني. أوكي؟ هذه هنا هذه الاريا شفتيها؟ هذا الريد هذا النورمال هنا حتلاقوها white. ما أدري واضحة بالصورة؟ في المحاضرة؟ واضحة ها؟ So هذه the area which has abnormal cells and you take the biopsy from there. طيب, after application of lugal iodine, okay, with a cotton swab and then let it dry, A normal vaginal and cervical squamous epithelium will contain glycogen-rich cells. Okay, they will take the iodine state and it will turn black or brown. خلاص؟ طبعا this plastic epithelium it will contain only little collagen and it doesn't uptake the iodine. This is the background of the discoloration by Google iodine. Okay, and a normal selfie glycogen that absorbs the iodine and it will discolor into the brown area. تقريبا كذا شفتوا هذه brown هنا. هذه it didn't take the brown. So هنا brown. So this is normal, and this one is abnormal. So you take the biopsy from here. Okay? واضح؟
الذهبي abnormal.
الذهبي abnormal. واللي برا هناك هذا abnormal. Okay? طبعا التريتمنت طبعا هذا التريتمنت نتكلم عليه في مش spreaded cancer or obvious lesion. هنا إذا كان عندك carcinoma in situ. Okay? إذا ظهر إنه carcinoma in situ or CIN3. Okay? اللي هي moderate and high dysplasia. So how would you treat? By two methods. يا إما ablative or you excise. خلاص؟ يا إما you do ablation or excise. هذه في CIN3 or carcinoma in situ. طيب؟ طيب. What is the difference between ablative and excisional? Ablative أنت بتحرق المنطقة. صح؟ Excision you will take part of the cervix. You will excise part of the cervix. طيب؟ Ablative you will not have any pathological specimen. لأنه you just burned it, right? Excisional, the benefit of the excisional is that you are taking biopsy and you are confirming that there is free margin. يعني أنت إذا أخذت excision تشوف lower layer of this excision إذا ما فيها cancer cell حتطمن, right? So this is the benefit of excisional. فاهمين؟ يعني متابعين معاي ولا ضايعين؟
لا ما
ممتاز. So these are the two treatment options. We have ablative and excisional. Excisional is better because you will know the free margin of the excised biopsy.
معلش دكتور ليش نسوي من البداية ablative يعني مو يعني more unable to do or less available.
لا هو طبعا التريتمنت اوبشنز اللي كانت من زمان كانت موجوده. الابليتيف موجوده كانت واحيانا بعض الناس يسوونها الى الان خصوصا في CIN1 or mild dysplasia they can do. Okay? The severe I don't recommend ablative. Deep cone biopsy اللي هي excisional biopsy is the best because you will know where it is the free margin. تفضل.
Excision doesn't affect the pregnancy.
طيب. بالنسبة للإكسجينال طبعا the first excisional we take about 1.5 centimeter from the cervix. Okay? But this one it will not affect the cervical يعني ما يسوي incompetence. Okay? If you take for the second time you do the excisional for the second time هنا in pregnancy it will be at risk of preterm labor لأنه الcervix يكون very short. فهنا you have to do cervical suture.
Or ablative.
Ablative لا إذا كان for the first time. Still ablative you are burning about 1.5 centimeter from the cervix. Okay?
طب يعني مثلا كانت في حمى عندها خطوات انها تحمل في المستقبل ولا افضل لها ablative recommendation يعني.
طيب بالنسبة لا إذا هي تحمل في المستقبل excisional better. لأنه you need ها؟
عشان ديك خيطة يعني.
لا هي excisional you are taking part of the cervix. Okay? هي طبعا young age صح؟
Oh yeah.
و for your own يعني or her own satisfaction you have to know that there is free margin behind the lesion صح ولا لا؟ So better to do excisional. Ablative
To regrow يعني بعدين.
لا to not regrow.
إذا في right margin.
لا خلاص إذا أخذت part of the cervix it will not grow.
دكتور أنت تقولي for the first time for the second time. فكرة يعني إن ناخذ مرة الأولى.
آه Okay, like, let's say that for the first time you have CIN2 or 3. CIN2, let's say CIN2, okay? You took excisional biopsy, okay, اللي هي 1.5 centimeter, and then you have to follow your patient, صح؟ سويت المرة الأولى pap smear كانت normal. بعد 6 شهور you have to take another pap smear. طيب؟ كانت abnormal. رجعت السيلز حقتها رجعت.
تسوي كولبوسكوبي.
هنا تسوي نفس الشيء، تسوي colposcopy وتاخذ biopsy to confirm. Okay? If it is confirmed that she's CIN2, then you do a second excision. Okay? هنا pregnancy will be affected. Some ladies from the first excision it can be affected. Okay? But usually on a second excision it will be higher risk for cervical incompetence. Okay?
دكتور ايش الحالات المفضل فيها بداية مع الاكسجين؟
شوف both of them they are يعني they are mode of treatment. يا تختار excision يا يعني ما في واحد يعني هذه له حالات وهذه له حالات. عرفت؟ أول ما يحصل عند البيشنت mild moderate ولا severe you have to do this treatment يا إما ablative يا إما excisional. طيب في دكاترة سووا ablative في دكاترة سووا excisional. But studies show that excisional better. Okay? In only this part إنه تعرف ال free margin. فهمتني كيف؟ بس you can do ablative. It's not wrong.